survive and prosper, the private insurance companies, if they provide better service. Remember, the argument against the public option is that when the government gets in, it will run it badly and that it will be too restrictive. I think there were contradictory arguments made against that plan. One is that when the government runs it, it will deny people free choice and it will be too restrictive, and two, it will be so attractive everybody will join it. If you're a lawyer, you can go into court and argue two opposite views. It's called arguing in the alternative. You can't really do that in any other case. Lawyers ought to be careful about it too. And the answer is, if the private plan provides better, faster service and doesn't restrict, then it will prosper. The public plan, it's up to the people. People aren't stupid. The public plan does not have a subsidy. It doesn't have the profit. The profit that goes to the private insurers' stockholders will be out of there. So the question is, and these are the two competing poles. A public plan would have less upfront expenses, but people fear that it would be too restrictive in terms of choices. If it is, rational people won't join it. So that's the answer. It will or will not lead to a single payer. By the way, I am not opposed to single payer. I like Medicare, and Medicare is single payer for elderly people. What? I'm sorry, but when you all yell at once, it's hard to understand. So the answer is, what? Oh, Medicare is bankrupt. No, a couple of things I would say about that. First of all, yes, I am in favor of single payer, and that's why I like Medicare. You act as if you people have discovered it is August. I have been a co-sponsor of the single payer bill. I think it would be better. Let him yell, please. What did you want to say?
And then we watch tapes of Obama and everyone else secretly say they're in favor of an eventual single-pay system.
I haven't, sir, it's been 21 years since I had a secret. And I don't have one. And I don't have one now. You have discovered that I'm for single payer. I've been a co-sponsor of single payer for years. I'm sorry, so may I please, when you're through, I will explain this to you or you talk. Which would you prefer? I do believe this. I don't have the votes. The votes are not there in Congress for single payer. They may not even be there. Once again, people have made discoveries that everybody else knew for a long time. The fact is that here's the argument against public option. It will lead to a single payer if people overwhelmingly prefer it. Now, if you are one who thinks that when the government runs healthcare, it will do a lousy job and be too restrictive, you shouldn't worry that people will voluntarily choose it. I think many people may, because I think having to get health insurance and pay the profit element of it drives up the cost. But no, I have made no secret of this, and I don't understand you're astounding at my telling you I've always been for it. I do believe that we will have a competition, and if you think that the private sector will do it much better than the public sector, why are you worried that people will voluntarily choose what you think will be the worst plan?